begin with two quotes from the book that I wrote, because I think it's relevant in our work with people with mental illness. The first is this woman who had spent 40 years in the mental health system, psychiatric hospitals, residential programs, every imaginable diagnoses, medications, suicide attempts. But she was on a dual path. And her journey, from her perspective, was how to figure out where God was as she struggled with her mental illness and how she could manage her symptoms. Unfortunately, none of her providers ever addressed the question of where her faith was for her. And because she was a fairly difficult patient to treat, they referred to her as she's into her devil thing, but they never explored with her whether her faith was a part of her strength. And she was actually the person who got me interested in writing my book, because after she died, I learned that she had willed me her crate of journals. And there were about 25 journals that dated, and it was amazing that she even was able to keep them given her trajectory through the mental health system. But in it she says, if I share my story with you and you share your story with me, we can both learn from each other. And then Bud, who's also in my book, who was probably the person who made me decide to do it, he said, there are people in every neighborhood with mental illness who are looking for God. The medical world does not have all the answers. We may be crazy, but we're not stupid. So I think those two people, both of whom had spent their entire adult lives in the mental health system, really speak to the importance of how we need to pay attention in working with people with mental illness to the faith dimension. Both of them died with cancer, and both of them, toward the end of their life, said it was much easier to die with cancer than to live with the stigma of mental illness. So if we think about what stigma means, the definition is that it's a distinguishing mark that is burned or cut into the flesh, like the numbers etched into the prisoners of the concentration camps. Something that detracts from character or reputation, that it is a mark of disgrace. The words we have used in relation to those who live with mental illness, lunatic, deranged, demon-possessed, insane, crazy, weird, nuts. The historical actions that we've taken in relation to people who live with mental illness have been bleeding bad blood, locking up individuals, submerging them in ice baths, putting them in restraints, shock treatment, lobotomies, solitary confinement, or burying them with only a number. Even today, in jails and prisoners, inmates with mental health issues are locked in solitary confinement. So if you think about how to drive a person crazy, it's to lock them up for days and weeks and months with no sun, no exercise, poor food, and awful surroundings. Now, I cite these examples because of the effect they have on our collective unconscious. We need to ask ourselves, what is the disgrace of having a brain that, through no intentional fault of our own, is not functioning well on our behalf? Why is a person with a mental illness or his or her family to blame if some brain wiring is not working as it should, any more than some cells in our bodies that lead to cancer because we worked in a toxic environment? What exactly are we ashamed of when we find it difficult to admit that I live with a bipolar disorder or my son suffers with schizophrenia? Are we still living out of Freud's assessment that schizophrenia is a result of bad mothering, that a person is possessed, or that a family has done something wrong?